So obviously the internet played a big role in this, but I'm not here today to tell you that the internet is the panacea, the cure-all. I am here to talk about the role it will play and has been playing for some time now in effective healthcare. And much of it has to do with what's happened over the last 20 years to healthcare in general. Everybody remembers the 90s, the managed care revolution. We were going to go to the same doctor all the time. He was going to tell us what other doctors we needed to see and make arrangements for us to get there. That was when the doctors were on top of the pyramid. The patients were kind of down at the bottom, and they did largely what they were asked to do. Over the last 20 years has been the media revolution, not just on the internet, but the advent of 500-channel cable TV, and now it's probably 5,000-channel cable TV. So you can find almost anything you want on healthcare in a variety of media. In interactive media, on TV, still in the newspapers. I see more and more in the radio, hear more and more in the radio about healthcare. Much of my firm's work is to get positive coverage for physicians and advancements in medicine in traditional media. And today, healthcare is still the third most covered topic in the news after politics and celebrities. So medicine is a big infotainment topic, and you can find it everywhere, and you can find people to talk about it everywhere. And you can connect to them, especially now through the internet. You can have multi-directional conversations with other patients, with healthcare providers, with family members, and more importantly, you can find them through any number of new venues. So the web is having an enormous impact here, and as a result, the patient has been put on top of the pyramid. It's not just the web, of course, but I would say probably as a single factor, the web is the largest contributor to this. It's much more of a doctor shopping world today. Coupled with this, of course, internet costs and computer costs have plummeted. As you can see here, they've dropped by half in 10 years, and now you can get a good netbook for even less than this, about half of that lower figure. According to Nielsen, 81% of the homes in America do have access to the internet. And according to the Pew Research Center, by the way, if you're not familiar with Pew, they do wonderful, wonderful work in sociology and especially Americans' habits for healthcare. In 1 year, community or home broadband adoption rates rose the fastest ever due to two reasons. The number one reason was people said they wanted to be more connected to their community in general. And the second reason, almost tied with it, was they wanted to be able to communicate with healthcare providers. That was a couple of years ago. In that finding, they also learned, quite surprisingly, that the two fastest growing groups are the elderly, age 65 plus, and the low income people. These are still somewhat low numbers. There's still some lack of good healthcare connection in some places, but it's rapidly vanishing. And as a result, every day, according to Pew, 8 million people go online to look for healthcare information. That's 96 of every second of every hour of the year. 8 million. 85% of us have cell phones now, and 6 in 10 of us use those or some other device to get on the internet wirelessly. So we ask, who is left out of this webolution? Well, as you might suspect, it hasn't caught on quite yet in the healthcare world. New England Journal of Medicine, one of the most reputed medical journals of all, found that less than 20% of physicians have any kind of electronic medical record keeping system. So you'd think, well, maybe hospitals, they're with it, right? They got all this money, they can throw at this kind of stuff. Well, and the Harvard School of Public Health found that's even fewer, less than 10% of those have even the basic EMR system. So the New England Journal of Medicine in the survey asked physicians, why the holdup here? And 2/3 of them weren't comfortable with the cost, and almost half said they just weren't sure it was going to be reliable and it wouldn't be obsolete. Well, we're going to have costs taken care of pretty soon because of some federal stimulus. But the interesting thing I find about this is that the medical field is one of the most rapidly advancing in technology, but only in biomedical technology. I would like to see much more rapid development in information technology. I know a office manager for a very successful neurosurgery practice, and she told me in confidence one day, you know, that doctor can spend half a day crawling around somebody's brain with a microscope, but he still can't figure out how to open his email. So I believe there is a digital divide, and increasingly, I believe it's society and physicians. It's doctors and everybody else. Now, I want to be fair, especially to any physicians in the room. This is not uniform, and it certainly does not apply to every physician. In fact, I'm very delighted to say some of our most informationally technological and wired clients are doctors who spend a lot of time on the internet, do their own blogs, some of them even set up their own websites and all that. What I find lacking, though, is a full integration of communications technology, not just the internet, but communications technology in general, into the practice of medicine.